I try to share, and sometimes it may bother people that my personality is upbeat. It's because I feel like I've won, and I'm continuing to fight to make make it happen.
Nora Speaks is a weekly podcast that tugs at the soul and consciousness of the Black community. With show topics such as youth empowerment, education, women's impact, and civic engagement, Nora Speaks challenges the listener to not only join the movement, but be the movement. On the show, you'll learn from insightful guests who have demonstrated capacity in these fields and more, and I'm your host, Nora Muhammad. Welcome to the show. Welcome to another episode of the Nora Speaks podcast. I'm so excited for this episode because we have with us a very dear sister of mine, and she's going to be a sister of yours once we finish with her today. And it is my sister, Sister Evita Ali. Assalamu alaikum.
Walaikum salam.
It's good to see you, sister.
It's good to be seen, as they say.
So I'm looking at my sister while we're doing the interview. And I'll tell you, Sister Evita, I'm very blessed and privileged, I know, to have you join us on the podcast. This is a podcast that's for the edification of our people and our community. And certainly the message that you have to share and that you will share with us regarding breast cancer awareness will definitely enlighten us, and it will leave us more informed than when we begin this episode. So I want to thank you again and just tell you how much I appreciate you joining me on the podcast.
Well, thank you for giving me the opportunity to share, because so often we don't share when it's something very personal that affects our health every moment, and we're just scared to share because we don't want people to know. People like it's a secret,
Mhm.
and it affects us, and once you get something that affects us long term,
Mhm.
way beyond the past the point where you're done with care, it still affects us, and we become, we become down and out, and people don't know, and we carry it, and sometimes even angry. So is I try to share, and sometimes it may bother people that my personality is upbeat. It's because I feel like I've won, and I'm continuing to fight to make it happen, as they
Yes,
say.
ma'am. So I think I'll put out a disclaimer right now that this interview is with a sister, and she's going to talk to you like she's your homegirl because she's just that kind of sister. She's going to give it to her straight, no chaser. And I believe the audience is going to be very comfortable with you, Sister Evita. So the last time that you and I spoke with each other in person, I was in Chicago, where you are, where you live, and you are a member of CROW, the Coalition for Remembrance of the Honorable Elijah Muhammad. And every year, you all have a wonderful event called Founders Day, where you honor the founders of CROW. Brother Munir Muhammad, one of the co-founders, has been a prior guest on the show. And we've had Brother Jamil Muhammad, who's the television host at CROW TV. And we've had Brother Mandine Muhammad, who's one of the executive producers, and he's also the host of Elevated Talk. He's also the owner of so much, right? He's also the owner of goodness, his
Legacy men's
Legacy's Men's Boutique. Thank you, sis. Legacy Men's Boutique, where I go in there and I find you there too. And Sister Akila Ali has also been a guest here, and so now I'm grateful to have you here. And when we spoke in Chicago at Founders Day, somehow the conversation got to breast cancer health and breast cancer awareness. And you were just, I think, very organically sharing, your experiences and just, being a forthright woman as you are. And I just thought to myself, I need Sister Evita on the podcast. And I know that every October you have an event And I
Yeah.
said, well, I'll invite her to come in right before October so that we can talk about that and we can find out how we can support you.
Oh, yeah, that's very I appreciate that. So every October, well, starting, I think this would be my 3rd year of having a breast cancer walk, and I fondly name it Pink in the Hood. And people look and they laugh and they go, "What?" I said, "Pink for cancer and the hood because this is the neighborhood. This is where we are. This is where I want to help my people who are less likely to seek out assistance for healthcare reasons. And I just want to make them aware. And because Black and brown women are affected greatly because of that. Either when we go to the doc, we don't go to the right places,
Right.
or when we're seeking assistance, we allow them to do most of the talking, and we never ask the appropriate questions in order to get the assistance that we need. So, I just think it's very important, and I finally feel like one of the reasons why people don't seek out healthcare is because people like how much it costs. I
Mm,
have, a very young age, very, very young. I had to be a teenager. I always say, "Bill me," because you have to take care of me, but you can
right.
bill me,
That's right.
and we'll figure it out somewhere down the line how it's gonna get paid.
Yeah.
And it wasn't until later, while I was going through my healthcare journey, that I found out each hospital has some kind of forgiveness to help out patients who cannot afford healthcare. It I was baffled and thrown away. I was like, "Oh my God, is this really happening?" So I'm thankful for that, and that I wanted the information, and I was probably acting crazy enough for them to say, "Here, let's help you out."
Hmm. So, Sister Vita, I mean, you laid a lot out right there, and I do want to unpack it, piece by piece. Now, earlier you were talking about us not sharing our experiences, and this, we want to keep these secrets, and so I wonder, is there, or would you think that that's due to shame?
Yes, I've heard people say, "I don't want anybody to pity me." I'm not
Mm,
exactly sure what that means. Pity or people being concerned. I think we may confuse the 2. Um, of course, if I hear something is wrong and you're going through something, the saying, "We don't ever know who can help us." I'm just a talker, and I'll share with anybody. I'll say something, and I've been surprised along the way. Somebody else will go, "Really? I know, da 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 da," and it goes through this thing where people reach out to someone else who can assist you with something. But if we keep our mouths closed, they said,
mhm,
"Closed mouths don't get fed."
right.
That's such a true statement, and I just think it comes from a history where I have to look to you like I am I am woman, hear me roar. I'm superwoman because we always had to keep quiet about our pain and our suffering because we had families to take care of,
Mm,
children to take care of, and I can't do that if I'm down. So we suffer in pain.
wow.
At night, we go to bed, we are suffering in pain for ills that we have, and we never share, and the next thing we know, it's gone beyond the point of
Mm.
helping someone, and that's the sad part.
Now, Sister Vita, wow, that's so true about Black women and probably women in general.
Yep.
Taking on the roles in families, and making sure everybody else is okay, and putting ourselves on the back burner. And I've heard it said once, sister, where not asking for help, we say, I'm good, I'm good. We say that a lot. And I heard someone say that that's arrogance. Not seeking help or not accepting help is a form of arrogance. And I had to really think about it because, and the person said, who are you? People have help to give. Like you said, these hospitals, they have, that charity care, they have forgiveness programs. Who are you? Because when help is needed and we decline it, then, there's going to be really unfortunate outcomes that could have been avoided.
Yeah.
But we want to take and shoulder that and kind of do so with pride to our detriment and often the detriment of our families.
I try my best not to put a label all the time on something because I don't know you. I don't know
Mm,
why you've made the decision to say, and I get it because sometimes or people's like, yeah, I'm good. It's like, but even if I tell you what you're gonna do about it, that's also the thing that we say a lot. And I'm like, well, I don't know.
mhm.
I have a new job and I was talking, I speak to people, hey, how you doing? And we started talking. I was talking to this gentleman and he was like, you share. I'm like, yeah. I mean, you said, how was your day? It was good.
Right.
And this is the reason why. I mean, like, but you asked.
You
You
asked,
know,
right.
you know what I'm saying? So if you don't really want to know, but people say that's just a polite thing to say.
Mm,
Well, I'm sorry. I don't know. Sometimes I try to figure out, I don't know why I'm like that. And I just I always tell people I'm an open book. What do you want to know? There's not too many. There's a way you share information about who you are so that people know who you are and they want to get to know you better.
mhm.
And so I try to do that to make it easier or softer for people to engage with me. And if that's the only way I know how to do it.
Well, Sister Vita, you're such a likable person and you have such a likable, open disposition and personality that I would imagine that somebody who is, even if they've been suffering quietly around their own family and friends, that you're someone because of who you are. And I think that's a gift to others that you could be someone and you are somebody that would share and, the Pink in the Hood, breast cancer awareness walk. um I know that, as you said, there are people who don't know things, who don't know how much they should talk at their own medical appointments. I've been with
Yeah.
people who the doctors come in, they tell them some things and they don't have any questions, and I'm thinking I have about 5 just off the top of my head. You know what I'm saying? Um, but I
And
think.
sometimes
Go
we
ahead.
don't get the information back we want. And I'll share this.
Yes.
I used to have problems with fibroids. And it started off with polyps. And I used to have these pains. I had just gotten married to Brother Zeppelin, and I just remember it was like December 1st, and it
Mm,
had to be 1997. And I was like, okay, these some bad cramps, but I was like, this is painful. I went to 3 emergency rooms. And I just remember the doctor is like, well, maybe she's backed up or maybe she's this and that. But
wow.
what I find when women go to the emergency room and you have lower abdominal issues, you're not being taken care of in the emergency room at that time. They'll set up an appointment with you. They'll do something or give you something, but they don't have anything set up to help women if they're coming in with lower abdominal issues. They came up with so many excuses. Then
Mm,
I finally got to a doctor. I said, you know what? Let me stop going to these crack emergency rooms. I know the University of Chicago is a good hospital. It's a teaching hospital. And I met this doctor and she did an ultrasound and she told me I had polyps. And I said, are they supposed to be there? No, they not. I said, let's get rid of them. And then she said, you don't want to go home and talk to your husband. I said, who killing in his pain? Me or him?
right.
I said, they're polyps. You're just going, you told me the procedure. You're going in and scrape them out, and then I should be fine. And I'm like, what are we discussing? I'm in pain.
Right.
And so we finally did that procedure. I was glad to get rid of them, but it seemed like maybe a year and a half later, I'm back at it again with fibroids. And I was like, Dr. Blanchett, I am in so much pain. I want to jump out the window.
Mm,
And she looked at me and she was like, well, we're going to give you a pill to stop your menstrual cycle. And I sat for a second. I said, but wait a minute. Isn't it natural for a woman to have a menstrual cycle to release
right.
that out of her body? And she looked at me. I said, yeah. I said, okay, thank you. because that didn't sound right to me. I know for my body that's a natural process.
Right.
And I was talking to my aunt, and she referred me to a doctor at Rush Hospital. And when I got in there, she said, "Look," yeah, she was a black doctor. She was very tough. She was like, "Look, I'm asking the questions. I don't want you to say anything. Just
Wow.
answer me." And I felt like, okay. I felt like such a like I felt like I wanted to sunk in like this.
Yes.
And when she asked me all the questions, and I was like, yes, no, and she got up, she said, "Who's your doctor?" I said, "Dr. Blanchard at the University of Chicago. I know her. She lives down the street from me. You tell her I said all she got to do is." I said,
Mm.
you my doctor.
Right.
No, no. If you said that, you tell her I said." I was like, wait a minute. That she remained my doctor
Mm.
for 10 years,
Right.
so I said, "There's no way in the world." I trusted her, and she was just one of them doctors that might have seemed tough or whatever, and there were moments where, I was in my sensitive moment with sometimes how she might have spoken to me, and I was like, "Wait a minute." I said, "Wait a minute, Dr. Boatwright, why I'm feeling some kind of way." She said, "Okay." She yelled out to her nurse, "Put Miss Ali in a room in my office." And then
Mm.
she said, "I'll be right with you." And she came about 10 minutes later and came in the room and talked to me for about 30 minutes about
Mm.
my issue. But that was because I found a doctor who cared. She
Right.
was a doctor that looked like me. And that may not be great for everyone, but I still said, I cannot walk away from here feeling like this.
Right.
And, because I'm like, wait a minute, I just felt dismissed. And I didn't want to feel dismissed. Because I still wanted my care taken care of.
That's right.
And sometimes I don't think they realize, you know, that they're trying to get to the next patient and understand that they're busy and that there's a lot going on. I get that. But for me, I didn't just want to be that number. You see me
Mhm.
too much.
Right.
You see me too much. And it's not just once a year. You were seeing me often.
Right.
So I needed to point that out.
Yeah.
And if nothing else, let's just say if it didn't work out, I spoke my truth.
Mhm.
And that's
Yeah.
sometimes what we have to do.
I'll tell you, there have been doctors, Sister Vita, that I've had, and um, when I'm waiting, sometimes I'm waiting for a while, and I may even be in the exam room waiting for the doctor to come in, but I can kind of hear muffled voices in the next room, and I said, "Oh, she's with another patient." And I know that even though her attentiveness to that patient is causing me to wait, I know she's gonna come and give me that same kind of attention. I'll
Yeah,
wait. So that's a
yeah,
doctor that I wait for. So it's great, sister, to have medical providers who do take the time and who do have sensitivity. Um, but one of the challenges is those kinds of doctors may be far and
it
few, or just
yes,
hard for us to find. Maybe they're there, they're just hard for us to find, or because their name is out there and they've gotten so many referrals, maybe their
yes.
appointments are backed up.
And I'll say this, I think sometimes we build up blockers for ourselves too,
Mm,
because the truth is, we really wanna look at people that look like us.
that's the truth.
I think that is one of the main truths. We wanna look at people that look like us because we feel like that's the only way that we can relate and that they'll understand without us even saying
And
much.
sometimes that's true.
And but I've had doctors, and I remember I had my primary care doctor at the time I was diagnosed. He was, I'll call him kind of young, a white doctor. And I remember I had him once, and his disposition was kind of like, I'm like, I would, because if you come in, I'm like, hi. He's like, how you doing? And I'm like, mm-mm. I didn't, if if I'm upbeat, I need you to be upbeat too.
Right,
Meet
right.
me where I am, thank you. And so I stopped going to them, and then they gave me a call, and they was like, "We was wondering if you wanted to come back." And I said, "Okay," he at the hospital I go to is easy for me. I don't have to travel somewhere else.
Right.
I came back, And when I met him again, and we were talking, and I just go, sometimes I tell doctor, I said, loosen up. Yeah, loosen up a little.
Yeah.
I said, so, I was like, I said, what's wrong with you? You seem, I was like, come on, you want to share. And sometimes they may need that.
Mhm.
Sometimes, and I'm not saying all the time, I'm just, and maybe it's because, I'm like I tell people, maybe it's because I'm a little crazy, but I need you, I need you to loosen up because my history. You
Mhm.
get the history of my life. You know everything that's happening to me in this chart. So you know me better than I know you.
Mhm.
So you can make a determination about who I am based off how, because of my health care,
Right.
whether I'm eating right, drinking, because now you go to the doctor, they ask you about how often do you drink? You
Mhm.
know, how often are you a drug user and
Right.
what kind of drugs? They ask that so that they can take care of you because
Mhm.
whatever it is you're putting in your body affects your body. Even like sometimes that's what they, like, what do you eat? How often do you eat it?
Mhm. Right.
So that's how they can take care of you. And we find it offensive at moments. Like I hate when they ask me, do you have diabetes? I said, what? I said, no, I had no diabetes.
Sister Evita.
And I'm just saying, I said, why do y'all always ask Black women that?
Mhm.
Don't ask me that question.
Yeah.
I said, do you see in my chart anything that looks like? And I say it because I remember when my aunt was going to this doctor. She had been going to him for years. So then it got to the point where somebody went to the doctor with her, and she
Mm.
used to have all this medication on her dresser. And I was like, what is all of this? What are you taking? And she used to get Charlie horses in her leg, and she'll be in there screaming, and we're coming in rub her leg. And
Yeah.
I'm like, she was like around 87 at that time. I was like, what in the world? What's happening? So we go to the doctor with her. And he said she had high blood pressure. I said, then what is it that she's supposed to be eating? And he said, well, she can eat what she wants. I said, that's not how
Mhm.
that works.
Right.
And then I said, okay. We came home and cleared the dresser,
Mhm.
threw it all away. She passed at 96. She stopped having Charlie horses in her leg.
Wow.
She stopped having all these issues because you're not going to play with the medical industry and they're sending you whatever the latest drug is and you're giving it to her. That's not
Mhm.
going to happen.
And
She
see,
didn't like that.
and that's medical advocacy and being able to be an advocate sometimes. Some folks, whether they're younger, older, or even some of us, sometimes it may be hard for a patient to advocate for themselves. That's why it's always great, especially if they're dealing with a significant concern, to bring a loved one with them who they don't mind hearing, some of their personal details. Now, Sister Vida, you have the Pink in the Hood breast cancer awareness walk. You do that annually, and it's your third time doing it. Let's back up, and your journey began with an examination.
Yeah, it was like a Saturday and it was a beautiful day.
Mm,
And I'm like, oh, let me get this exam on because when I get out of here, I'm doing this, and this.
yeah.
And if you women, when you go in there, you're like, please hurry up and get this out the way.
Yes.
And so I was doing they look at me pushing up. I was
Mhm.
doing the exam. And it's like, okay, wait in the lobby, we'll be right with you. And then the lady come back. We want to check one more thing. I said, okay, still, I'm like, let's hurry up. Go back in there, smash, smash. And then they came back out and I'm waiting in the room. And I told people sitting in that room and out in the lobby, I didn't, the music, the feeling, I just felt like, am I at a funeral parlor? Like, why is this
Mhm.
music playing? And then somebody came out and it's like, the head doctor would like to see you. I'm still oblivious. What y'all
Mm,
talking about? Now what? Because all I've ever heard is people with dense breasts and whatever. I'm like, I didn't think nothing of it.
Yeah.
He did the ultrasound and then he said, "Okay, you can sit up." And he looked, he's like, "We don't sugarcoat things around here. This is breast cancer." And I
Mm,
was like, "What? Huh?" And then I just kind of sat there like, what did he, and I'm thinking in my mind, like, what did he just tell me? I was like, okay, now I gotta go home and I gotta tell my family
right.
because I'm, of course, like I said, I'm a sharer. I got to tell my family. My mom was living here at the time. And so the whole way home, I'm like, almost like hyperventilating. I'm like, how do you share this information? What do you say? And then what's next for me? And the
Right.
one thing about the hospital is that they send the information to your primary care doctor and they can set up an appointment for you for your doctor. And so I said, okay. And so if that was Saturday, I saw him, I think Monday or Tuesday. But
Mhm.
when I got home, I saw my mom and I was like, I just came from the doctor. And she was like, what? Because they knew I was going to do an exam or whatever. I said, they told me I had breast cancer. And the look on her face, and then she hugged me and we cried, but still it was not real to me.
Right.
'Cause I'm like, oh, that's just the ultrasound.
Mm.
Then I saw and I knew, so that same doctor I was talking about, I went to see him, and the way he came in a room and he pulled up the chair next to me and he grabbed my hand, I was like, oh my God.
Yeah.
He's like, I am so sorry. This look. And then he was setting an appointment for me to see a particular doctor, and she wasn't available. She was the main oncologist over the department. She was not available until the following week. Evita's not waiting till the following week.
Yeah.
We got to find out what's happening. And I'm thinking, well, she's over the department. She go tell whoever what to do and how to handle things.
Right.
And I made that appointment. So I think that was Tuesday. Thursday, I saw the doctor. And so everybody's like, who's going to go with me to the doctor? So I had two of my cousins and the lady. So as she came in, first one doctor came in, he's just getting the information, right? Da, da,
Yeah.
da, da, da. He's tapping and we looking at him and I'm sitting there, swinging my legs on the
Yeah.
table. He left out. And then when she came in, Dr. O'Donoghue came in, she's like, okay, the cancer, da, da, da. My cousins were like, no, wait a minute, wait a minute. And she was like, oh, I'm sorry. I apologize. She pulled a chair up. She sat down and pulled it next to me. She said, we looked at the ultrasound that was sent to us, and this is breast cancer. She said, I see this every day.
Mm.
This is what it looks like. And after that, all I heard was blah, 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 blah. And my cousins, they started asking questions because, of course, when she started giving me information, I would ask the same question again. I
Right.
kept asking the same question again.
It's hard to
And
retain information under that kind of stress.
and she was like, "Don't worry, this happens often." She said, "I don't give a care how many times you ask me a question. I'm just gonna answer it."
Sure.
I just kept asking stuff, and I'm like, I don't, So she was giving me information what breast cancer was. They were gonna have to do a biopsy so that they can see what's there. And then from there, that would definitely tell them what it is and what type.
Mm.
And I said, okay. And I think if that was Thursday, I think Tuesday or Monday, or maybe it was a Wednesday, I was doing the biopsy. So I never got a chance to, oh, let's, breathe or let's go there. They were moving me along. And then definitely when that biopsy, when really, really the ultrasound saw two, but the biopsy saw four.
Mm.
And they said they're small, they're right above each other. So when I saw my oncologist again, I said, how do you know how long it's been there? When did it develop? How does it start? And they're like, they don't know that. That's what's scary. They don't know like when it started. And because of course, I don't know if it's because 2 years prior I hadn't had a breast exam. And I'm thinking like, dang, if I hadn't had one then, I never felt anything.
Yeah.
So if I never felt anything, how far would it have gotten before I had known?
Right.
But I said, Evita, that is your fault. And let me pull back. I'm sorry. Um, that's when it goes to how important it is to get our annual exams, because you just don't know. It's the
Mm.
question in between. So now that was always a question for me.
If you hadn't waited or had that gap of time.
Would I have known?
Mm.
But that's where I go when they say we're raising money for the cure. I don't think there is one,
Mm.
because you don't even know each person why it happens to them.
Right.
So of course, during that time, I know me and Jamil was talking, people would say, well, if you had, and if you take this, and if you had, and I'm like, shut the,
Right.
you know, that is
Everybody comes with their
not,
ideas, their remedies.
that is not how you talk to people.
Yeah.
And I used to like, I already got it. I'm whispering, that's how I already have it. So
Right.
why are you asking me, did I take this or do that? And that's why, Sister Mina was like, is there something that we shouldn't say? All you can say is, maybe, I'm sorry this happened to you. Um, is there anything you need? And sometimes it just needs a hug, something, some kind of concern, but not remedies or eat this and eat that and do this. I said, I had a coworker who doesn't drink, doesn't smoke. She always eating right. She was a pillar of exercise, doing triathlons, doing everything, and she ended up getting a rare form of cancer.
Mhm.
We don't know.
Right.
And some things you can say hereditary. My mom, my brother, that's why we're made up. And my aunt used to always say, genes are MFer. That's what she used to say,
Mhm.
because you're made up of your mom and your dad. And whatever the two of them are made up of, that's how you're created.
Right.
So we don't know. And people we miss, where many years ago, and I don't even know if I want to go back to the 70s or the 60s or how long that was ago, before people got married. You remember
The
you
blood
heard
test.
the blood test.
Mhm.
They used to test it. So that's happening. It's like, oh, you may not be able to have children because you have this. And even though it would be your choice, but you're made up of two different kinds of genes
Yeah.
and everything that's in these cells. And but we don't know. We never investigate what our bodies are made up of. And
Mhm.
so when we don't know that, we don't know how some people are most likely to get this. It may start, you're hearing, it's like, you won't know until the age of 10. You don't know until the age of 18. Like, why do I have to wait that long to find out if I'll have something?
Yeah.
Because my mother and father. That's why they get the medical history of your parents. But unfortunately, for sometimes us, and I only want to deal with us, we don't always know who dad is.
Mhm. Right.
We don't know dad's medical history.
Right.
We barely know mom's medical history because we're silent. We don't talk. We don't share. We don't say anything. And that's the negative part. Like,
Yeah.
I didn't know I had to say mom. I didn't even know, because my mom wanted to deal with things silently. We didn't know that she had ovarian cancer. She
Mm.
was trying to deal with it on her own. I'm like, woman, but that's how she is. And I told her, stop that.
And
I
I
want
think that too, that comes from a culture that we have had for generations, with, keeping things secret, with whatever's going on in this house stays in this house,
yes.
and just not, being open to that kinds of stuff. And I know that there's now genetic testing that people can do, even if they're just looking for their roots, but they can identify, like, if they're more likely to be lactose intolerant or to develop osteoporosis and things like that.
So they have that. It was called the BRCA test, and
Mhm.
everybody knows of the test. really, because Angelina Jolie
Right.
did it, and she found out that she had the history, and again, she could get, breast cancer, and she had her breast removed, and people were upset. If I can understand why women feel like being a woman means having breasts, I wish I can understand that. I'm just never been that person, probably because it was not a great asset for me,
Mm,
and I'm like, okay, I know it's a part of my body, and like every woman is not blessed to have a certain size or built up a certain way. How does that make you a woman? Or not? We do know, if we see a woman, we know that that's a woman because maybe she has breasts or maybe she has this. But make me a woman? What if, like, I had to have them removed? What
right.
are you then? And there's some women that I found when I was on my search on the internet that never got them replaced.
Mhm.
They were
Right.
like they were like, "No, this is it. This is who I am." And some people are like, "Oh my God, how could you do that?" And which is one another reason why I wanted to always have conversations to understand why a woman, once she was diagnosed, and she can be a stage 3, 2, 4, and they just said, "I'd rather do a lumpectomy." And that's when you go in and just remove the cancer from there,
Mm,
and they don't get the breast removed. But sometimes you'll hear people say, "I'm a 2, 3, 4-time breast cancer survivor." I was like, "Ugh."
mhm. So I guess in terms of, having the initial diagnosis and you and your physician or your physician lets you know, what the recommended next steps would be in terms of treatment, surgery, medication, chemotherapy. So
Yeah, they did that. I got a booklet and I put it up. It was a booklet, and I opened up, everything was about me, the different medications, the process it was gonna take, how often the medications, the side effects of the medications. Um, I told the story, I kinda chuckled. My cousin was with me. I came to see him, they was like, "Okay, you're gonna talk to different doctors, they're gonna tell you what's gonna take place, and then you can make your decision going forward, but if you wanna go forward, this is what's gonna happen." They say you're gonna see the radiology team, your oncologist, doctors, nurses, you're gonna bring in your plastic surgeon. If you decide to remove them, this is the plan they're gonna do. And I came in and they sat me in a conference room, but when I walked past the room to the left of me, I saw a table full of doctors. They all had white coats on. And then they sat me in a room across, and each set of different doctors came in to talk to me,
mm,
tell me what would take place, how long, what was going on, and any questions that I had. And each and every one of those doctors were very calm. They were very open. They were very. I felt good, and that I think that particular day was the first day it hit me, and I cried.
mm,
The other times I cried. I was like, "I don't this is really happening. This is really happening to me. This is." And not only I said, "This is like TV. This is how they
right.
show what takes place." I just never imagined that for me. But along that, in my mind, I kept saying, something's gonna go wrong. I don't know, something may not go right. I don't know what's gonna happen, but I started feeling, anxiety. I started feeling like, what if they give me a time? What if the chemo doesn't work and they say, "It's nothing else we can do for you?" What are you gonna do then? So I was mentally preparing myself for that.
Yeah.
And I said, "Well, you don't have no choice. You gotta go through the flow. You gotta do what you got to do." And then I had to, my family, I can tell at moments that they were uneasy around me. They didn't know what to say. They were is and then the crazy thing is, if I smiled, then they smile. You if I was happy, I'm always up for it. If you know anything about Chicago, house music is a thing, and that is me. So it would be I'm like, "Let me look, we having a party tonight," you know?
Yeah.
I just have to hear my music. I don't know what we need to do. It wasn't like I was going out. I ain't going out to clubs, but I'm like, "Where can we find, let's play some music. I'm gonna play it loud, and I'm about to enjoy my moment."
Right.
Um, and so and then, and my mother is a, conspiracy theorist. And she was like, "Okay, so my friend, she's going through it now too. And they told her, and I don't know why they told you this." And I said, "Look, lady," and this I had to talk to her, "Look, lady, don't come to me with what your friend going through. I get it. I understand. I hate that. But I don't give two flying kicks what your friend
Yeah.
doing." And
Yeah.
then she was like, "I believe they gave it to you." I said,
Wow.
I said, "Mom, look, how did they give it to me?"
Right.
But that's her mind, because
Yeah.
that's when you know who you're dealing with.
Mhm.
I mean, all the way up to the end. Like, she tried to hang with me, and I could tell her nervousness on my chemo, sessions. And she'll be there, and
Yeah.
she was just constantly talking. So when I hear my doctor's appointment coming in, so she'll talking, and then I could see the doctor kinda glance over at me, and I was like, with that look, and they let her talk.
Yeah.
And they let her say whatever it is she felt, and then they'll be like, "Okay, well, this is how we're gonna help you, Vita,
Mhm.
and this is
So
what we."
so you just kind of brought up a couple things, thoughts for me. One, um, doctors, they understand that, patients aren't just by themselves. They have families, they have parents, they have spouses, they have children, nieces, nephews that are attached to them, that are bringing so much to the patient, especially like, the example that you used with your mom. And the doctor is still going to talk to you, right? And talk to you as a patient and say, this is what we're doing, kind of direct that conversation to you. And then just a question kind of going back, you talked about all of the different physicians and the specialists coming in and
Mhm.
kind of giving you an idea of what's to come. I'm curious, Sister Evita, did they at any point have a counselor, someone to kind of deal with? You mentioned you were getting anxiety. Did they have
Yeah,
someone kind of deal with that to help you
yeah.
along?
So what happened, the day of my surgery? So when they removed, I decided on the double mastectomy, and they removed it, and they put in, expanders. That's to help build up later the breasts, when they wanna put in the implants.
Mm,
So, I was laying there, of course, drugged out. I was like, and this short lady comes in, and I couldn't tell whether she was Filipino or what she was, somewhere along there. And she's like, "Hi." And I'm, and I was like, "Yeah." She said, "My name is Doctor," I forget her name at the moment. She said, "I am here to help you. They felt it was best that I help you in your transition from this surgery, so that you
mm.
excuse me, understand what you're going through." And I'm like, "Yeah, okay." But I saw this lady every week for a year.
Wow.
And it got to moments where she was trying to help me understand what has just taken place. How do I feel about it? How do I plan to move forward? What are some of the things that I would like to do? Of course, she offered some suggestions, because that's what she did. She helped, breast cancer patients, just trying to adjust to some kind of normalcy.
Sure.
And I remember one time she was talking to me. She's like, "Well, what do you want your family to do?" And I don't know. I don't know what to ask. I don't know what to say, or how they can help me in any kind of way. And she she was, she said something to me, and I said, "Look," I said, "Black women do not have the time to sit up and cry and moan about what the bleep, bleep, bleep they got to do. We just got to do it. We don't have that luxury like white women do or other women do, where there's somebody possibly around to give them that. We just got to get up every day and do what the bleep, bleep, bleep we got to do. And then she said, "Did you just go off on me?" And I was like, "Yeah." And she said, "Okay, okay." And then we ended our session. And then she said, "Okay, I'll see you next week."
Mm,
So I said, "Oh, she can handle that."
mhm.
I get some family members like, "I'm done with you." I was
Right.
like, "Okay." She's like, "Man," she said, "Did you just go off on me?" I was like, "Yeah." I said, "You have to understand, we deal with issues as Black women, and sometimes we shouldn't have to,
Mhm.
but it's just the culture, and sometimes breaking the cycle is not always easy
Right.
because we see mama do it, grandma do it, aunties. We see them go through things and we see how they handle it, and we just kind of go accordingly. And
Mm,
you just try to figure it all out. And
yeah.
sometimes we figure it out by ourselves, and then it might not always be the right decision. But then if it's not, then we have to learn from whatever decision we make and then move forward to make the right one.
Yeah. Yeah. Wow, Sister Vita. Um, I as you're sharing your journey, I'm very careful, or should say I feel very sensitive. I don't want it to be like we're voyeurs to your personal experience, you know?
Here,
Um,
I'm here.
and I'm grateful because what I believe is that you sharing your journey and the transparency that you are and that you have is going to help others. I know it's helping me.
Okay.
Um, it's definitely helping me, and it has helped me, over the years as I followed your journey, um and the conversations that we've had, in person. It's been informative, and the and there's just so much. One, making sure we're getting our annual checks, being able to speak up. If we think something is wrong, well, then I guess there's another doctor I have to see. We see what's happening with Black women in the healthcare system. Um, Understanding how we, if we're a patient, especially of something like this, with having a diagnosis like this, then we have to anticipate everybody and their bright ideas, right? And their remedies and their cures
Right.
and their herbal recommendations. And um
And I get that because some people, um, we had and I don't know if you ever heard us talk, but there was a sister, and I think her name was Sister Shirley. She had my early days at Crow. She came in, she was I want to say, at the time, maybe she was middle aged, and she had ended up getting cancer. I can't remember what form. And she decided to take the natural way of dealing with her cancer and didn't listen to her doctors
mm,
until it was too late. And then she needed the help, but it was nothing else they can do for her. And she eventually passed. And I know my next door neighbor, she had, I think, ovarian cancer, and she had had it before, but she didn't have the hysterectomy.
mm,
Now she was way past the stage of having children, way past her children, way grown. She got grandbabies running around here, grandchildren, not babies. And she just didn't. So when she got it again, it's too far gone. It was nothing they can do for her. She
mhm,
ended up passing a few years ago. And I go, what makes you not? Um, so what my doctors also told me, if I had not already had a hysterectomy, I would had to have had one.
mm,
And I said, "What? That you mean to tell?" And it's something which is some information I want to look more into. Your body, women's bodies, the two, how they correlate with one another, and how, are you kidding me? I would have had to have a hysterectomy, and I had already had one. But I tell you something that I did that I thought about is, and this is not something my doctors told me, and I don't know where I got the bright idea, but just when you know your body, if chemo affects, because I asked them what's the difference between chemo and radiation.
Mhm.
So they said, I have a scar where they put in a port into my chest. So I had to have that surgery so that they can put the IV into the port as opposed to my veins so they won't break down my veins for the long period of time and how often they would have had to draw blood because even though I had my chemo sessions every other Thursday, but prior to the chemo session, they draw your blood and test it to see where your blood count, where your white blood count is and where some other things are.
Mhm.
And right before chemo, they would do that each time. So they ended up so you're going through with that. I said, well, if chemo affects the entire body when they're putting the the medication into your body, I can feel it going through my body.
Right.
I said, then maybe I need to make sure I'm good with everything else. I saw my gynecologist. I even saw my dentist. I
Mhm.
went to my eye doctor. I went to all these doctors just to let them know what was going on and to make sure that if I have to come back around, that when they're asking the questions, like, because they ask your medical history, I said, this is what I'm going through.
Yeah.
And I said, wow. So it was interesting. I found out I went to the dentist or maybe some months ago, and I noticed some of my teeth were kind of loose. The dentist had given me something during my chemo, prior to my chemo, said, use this because the chemo will loosen your teeth. It would do this something like break down your teeth, the enamel or whatever.
Mhm.
But I saw a dentist a few months ago and they said, you need to see a specialist because you have cavities where you had root canals. I said, excuse me? I said, how is that possible? And I said, well, maybe this doctor don't know what she talking to. So I have to find. And she's like, well, what is your history? And then when I told her, I had, breast cancer and I was doing chemo, she said, oh, yeah, you need to see it. And I said, wait a minute. So it's like,
Yeah.
dang, you feel like, oh, no, say it ain't so, Joe. It's always something.
Yeah.
And even just because I removed my breast, they said it can still come back
Mhm.
to your chest wall. I said, my chest wall. So those little suckers, things getting into your body and however because I just feel like when you do chemo or something, it didn't even shrink it a lot. Like you hope that it shrinks it all the way.
Right.
But it didn't. I was like, they strong. They wanna stay and hang in there for a little bit.
Mm.
So, but when they do the surgery, I woke up and my chest was wrapped real tight, and I said, "They really removed my breast." I mean, and then, you have what goes on in your mind, and
Right.
so the doctor let me tell you something. When a team of doctors come in and it's always the newbies, the young ones who come in and
Right. The
they're doing
residents.
their internship, and it was a bunch of them standing in front of me. And I think I might have been sitting in the chair at the time. And they said, "So we're gonna release you today." I said, "No, dog, you not." And then the expression on their face, because I can imagine if one of them was black, they would have been laughing, but the rest of them looked like they were scared. I
Mhm.
said, "You better do what you got to do, but I am not leaving this hospital today." Do you know what you just cut?
Th-
Cut.
Was this the same day that they were talking about discharging you? Wow.
Yes. Not today.
Mhm.
Not today, sir. And he's like, "Okay, I'll be right back." So he said, we'll write it up as something for the reason why you're not gonna leave. You have look, I just couldn't imagine. I was just out of it, because of course, okay, I tell you this. So it had to be the next morning because my you go in, of course, in the morning, then you go through the afternoon, and then the doctors come and check because I can't even remember how long surgery was. But I'm like, "Oh my god." So, you sleep, and my cousin stayed with me. Somebody was always with me. I had at least, oh my God, I had about 20 people with me
That's
when I
wonderful.
started chemo, all these people, oh my God. So what I felt also is when you're in the area where they're doing chemo, they had little pods, like little rooms, and then they had some that was open, but I always had people with me. And I would see the other patients and they were by themselves.
Mhm.
And I just felt like I wanted to share my family with
Right.
other people. It didn't matter. I didn't look at it like a black or white thing. I just saw people sitting there looking so withdrawn from life. And here it is. My family got me laughing and talking just to get me through. When I tell you those nurses and doctors are like, "Oh my God, you're a family. You're a
Mm.
family, you're a family." And I said, I mean, I don't know what to tell you, is that when cancer hit my family with other family members, none of them are living today.
Mm.
I've lost, let's see, the past 6 years now. Like, well, maybe it was a couple of years ago now. Year before last, my cousin passed away. One minute she was sitting there and we were talking, holding a full conversation. That was Thursday. Friday, she was laying in the bed, she was talking to me. I missed Saturday and came to see her Sunday. She was non-responsive,
Mm.
non-responsive. And the nurses, so they were telling my younger cousins, "There's nothing we can do with your mother." I said, "Then why the hell you got her hooked up to these machines? That's money. You're
Mm.
keeping her hooked up. If it's nothing else you can do, then why is that happening? If she all we're doing is waiting the moment for her to take her last breath, you got her hooked up." And then the nurses will come in and, I have an issue with, certain types and kind of nurses. And she coming in and she just grabbed me. You will come in the room and speak. I said, "Hello, how are you?" You don't walk
Mhm.
into a room and you don't speak to somebody and you just start touching a patient. That's not what you do. You're like, "Hi, how are you doing? My name is so and so. I'm here to take care of your loved one." She's already towards the end. So,
Mm.
no. And so some of my relatives like, "Oh, my nickname is Buttons." So they were like, "Buttons, this and that." I'm like, "Look here. No, you cannot let them think they're just stepping over you with no concern whatsoever."
Mm.
And I'm such an advocate for that. No, we cannot allow this to continue to happen to us.
Mhm. So
And sad.
yeah, so I have a question, sister, about um the aftercare and the supports that you needed in at home once you were discharged. And um I imagine that, there's really no real way we could probably prepare mentally for the kind of support that might, in some respects or under other circumstances, be considered invasive.
Yeah, because they had drains which drain the blood, that I
Hmm.
guess that's excess blood for you. I had 2 on one side and 2 on the other. My mama, I got it. You know,
Yeah.
she doesn't, "I'll take care of it." It was not her stomach, was not her thing, and the medications. What I did love about them, they gave me all my medications prior and said, "Fill them whether you
Yeah.
use them or not. We
Mm.
want you to have it on hand and not wait in case you needed the medication."
Right.
So the drains, once they fill up, I had to make a recording of, how much blood was coming out of, and then I had to drain them out and then redo it. So, I mean, some things ended up having to do myself
Yeah.
because they didn't know how or what, or it was, everything. Some people get queasy, like, never mind.
Right. Right.
You need something to eat?
Right.
I'll bring you something to eat. you
And
know,
and
that,
I think it's good too that people know what they can tolerate personally, and it's
yeah,
not personal, but some people just aren't built
yeah.
for certain tasks, right? But there's
And
other
then,
there's other ways that they can support.
yeah, and the patient has to understand that too. They
Yes.
have to understand that everybody can't do that. And,
Mhm.
so my sister, she'd be like, I'll be like, I know you can't. I know
Mhm.
you just can't do that. But so, I had to do it myself. And um, it was just, I just felt like it was a lonely time, even though I was surrounded about, with people. It was so lonely, because I'm up. Of course, when I come home from chemo or session, I would go to sleep and I'll be asleep. And then I'm up all morning while everybody doing the hours, everybody else is asleep. I was up. I was like, "Man, thank God for Netflix and Amazon Prime," and, those, because I was able to watch something, but I literally could not sleep. And then
Yeah.
by the time everybody else was getting up, that's when I went, felt, let's just say, I needed the rest.
Mhm.
And so the first, um, I think, it was 2 medications, a Adromycin and some other Cytose, something like that, was one that I took. So I would go to work, Thursdays, I would do my chemo session, and then but I would come back to work on Friday for the first 4 sessions that I did. And it was, okay, fine, but I said, "What are you doing? Like, why are you?" It was then it was a new job for me. Not that I
Mm.
really had to, 'cause, I because excuse me, because I get this thing in my mind, what are you trying to do to yourself? You need
Yeah.
the rest. And so I was changing my hours at work since I'll be up during a certain time. I was like, "Okay, well, I'm still wide awake at 6 and 7 o'clock in the morning. I don't fall asleep till the afternoon. Maybe I just changed my hours at work." So they let me do that for a while. And then when it came to, it's called Taxol. It was a medication, and they call it uh, the red devil or the red something else. Because
Mm.
literally, when I would take the medication, and let's just say I was like, I had to. I was like, I was constantly running to the bathroom. I was like, oh my God, what is this fluid is going through me? And everything was, they said, don't be scared. It's gonna be red or pink
Mm.
when it comes out your body. That's how you know the medication is going through your body.
Right, right.
I said, oh wow. And I was just not prepared to come to work the next day with that particular medication. And then they eventually let me go,
Mm.
even though they were like, "We'll be here for you, Evita. Miss Ali, everything will be fine. We're here for you." I said, "Okay, cool." And then I came in one day and they was like, "Meet us in the conference room upstairs." I was like, "Let my ride get away." That's what I felt. You let my ride leave.
Yeah.
And I went up there and they were, everybody was softly speaking to me, handing me some papers, telling me, "You may want an attorney to look at it." Look, I've been working in legal. I don't need no attorney to look at this. But it never said a reason why they were letting me go. It never said, "Well, we're letting her go because she didn't do this or she didn't do that." It never said. It was like 5 pages.
Mm.
So that's how you know they were really trying to draw up some so I wouldn't sue them. So I walked down to my office and my managers are like, "Is there anything we can do for you?" I wanted to say, "Bleep, can I have my job?"
Right.
But I said, maybe this is cool. And I called my mother and she cussed off and she cussed all the while coming to get me. I got all my stuff and I was standing in the lobby and got everything in the car. And then, "You hungry?" "Yeah, I'm hungry. Let's go get something to eat." And that was the end of that,
Yeah.
and I'm like, she said, You don't have to worry about a thing. You gonna be okay.
Right.
And so everybody, you're gonna be okay. Don't worry about it." And I was like, I don't have time to worry about it. Right now, the only thing I'm thinking about is making it through, getting past everything,
Right.
and just living my life because the rest of it don't matter.
Mhm.
So what if I went to work every day? You can go to work every day, and that is some sense of normalcy. But as you're taking care of your health, like, I lost all my hair, and my losing my nails, my toenails, my fingernails, they became dark, brittle. They were lifting from the nail bed, which is, I felt like, oh, is this what this medication is doing?
Yeah.
And so I didn't always feel like, ooh, I felt ugly.
Mm.
And luckily I had a black nail tech. I had been going to for some years. She said, oh, I said, I need you to make this look some kind of normal. Can you help me out? So she was like, we'll clean it up. We'll make sure it's okay. We'll clip it, clip things down if we have to clip it off. She just maintained it and allowed me to, so, you go to get your feet done. Everybody want to rush you. She
Yeah.
let me soak my feet. She took me the care that she took for me. I'll never forget that. And that is something I said, that's what I want to work hard and be able to provide some kind of spa treatment or self-care for patients. So I'm
Mhm.
like, when I lost my hair, I thought, okay, I saw all these scars and different things I wanted to wear, but it just to me, made me look sick, made me
Mhm.
look like something was wrong with me. I was like, I don't want to wear that. So, and I bought them, but I'm like, let me throw these to the side. And I just started, I'm wearing this ball. I'm
Yeah.
just gonna go free and however it looked. But it was so surprising. I would run into people. They were like, sis, how are you? And guys would kiss my head. I said, okay, this is random. But it was showing that, they were like, okay, I see you.
Yeah.
Everything's okay.
So,
And,
well, I was gonna
so
say, oh, go ahead.
I just felt like, oh, that was nice of them.
Mhm.
Sometimes strangers,
Mhm.
you know, sis, you okay? Sometime will grab your hand and just, or a hug.
Yeah.
You know, it wasn't invasive or anything, but it was, you know, show of concern.
Right. Compassion and like you said,
Mhm.
just letting you know that you're being seen, right?
Right.
Yeah.
Yeah.
Wow. So, I'm sure that was, in the scheme of things, having, an office to go to every day probably wasn't one of the most significant concerns, especially
No.
at a time like that. And you had mentioned that, you wait for the 5 year free and clear. And right
Yeah.
now you're post 4 years, right?
Yes.
Mm-hmm.
Yes. It's it's somewhat of a good feeling. I think I see my doctor Wednesday.
Mm.
And I go in, and what I like her, she has such a upbeat attitude. She's like, "Hi, how are you?" And then she's like, "Can I hug you?" She said, "You look good."
Yeah.
And so she's like, "Okay, what you've been going through?" They ask you because how I thought about it, we got a survivor. We have one,
Right. Right.
and that has to feel good about a doctor.
I'm sure.
That has to feel good to a doctor. And then now my plastic surgeon, when I see him, I never forget when I first sat down to see him, he was telling me everything that he was going to do. And he said, so you're going to be seeing me every year for the rest of your life. I said, you're my new man? Is this it? And I said, wow. I said, are you serious? Because that didn't even cross my mind um, that I'll be seeing this doctor
Mhm.
because I guess implants only last so long and then they have to take them out and change them. And
Mm.
I go like, that never even crossed my mind.
Right.
That was baffling to me. So I said, oh, okay. And the thing is, so when they had the expanders in and I would go to the doctor's office, I never saw him like a long period of time. He would take photos of showing how things were coming along and how it was healing. I said,
Yeah.
"Now don't be putting this on Facebook." So because I was always joking with them, I was like,
Yeah.
"Nah, don't be putting this on Facebook now. I
Yeah.
don't wanna find my picture somewhere."
Right.
And then so he was like, "No." And, so he was I remember when they were asking what size. I said, Well, what size was I?
Mhm.
So they couldn't take you back to your normal size for I don't know what the reason was, but they'll take you to a size that's, I guess, normal for your body or whatever.
Mhm.
And he said, he was saying, like, he has some patients talking about they want stripper boobs. I said, "What the heck is stripper boobs?" I'm like, "What are you talking about?" And, me and my naivety, I said, "Oh, never mind. Okay, never mind."
Yeah.
I said, "But look," I said, "whatever." And then the thing is, when they have when they put the expanders, it's a little, like, a metal part that when they get ready to go in and fill it, that they go around and they go, "Okay, there it is." Like, it's
Mhm.
like a magnetized and they can see it, and then they fill it with, uh, saline solution or some kind of, and then it stretches the skin
Yeah.
to prepare your body for the implant. And you go along, you go like, "Okay, okay, okay." Each week they were doing it. Then it got to the point I was like, "Yo, this is not feeling good."
Mhm.
You can leave me right there.
Mhm.
Because stretching the skin and giving the skin, and the body is amazing.
Yeah.
Body's amazing what it goes through and what happens to it.
Yeah.
And,
And
I
what it
said,
can recover from.
"Yeah." I was just shocked, and of course, I kept pictures that I don't know if I can ever, because what I didn't do was, they say when you get cancer, that cancer even can go, like, in the nipple area, the areola area, and I said, "What?" So when they cut me, they took that away,
Mm.
and they asked me, so when they bring it back, I wouldn't have any sensation in that area.
Mhm.
I said, "Okay, if I'm not gonna have any sensation in an area, why even rebuild it? Because that would have been another surgery."
Oh.
I said, "I'm not, no, no, thank you. I'm not having another surgery. It's not that important." It's like, "Well, what about your mate?" I said, "Look, if somebody doesn't understand what I, have gone through, they're not the person for me."
Mhm. Yeah.
You got people walking around one leg, you got amputees and whatever's, one arm, if people dealing with them don't understand that, that's not something. I said, it's not that important to me. I was never a person feeling like, my breast was the most important part of of who I was as a woman.
Right.
So I didn't want that. And if you said things can come back and I don't have any sensation, why am I even going through all of that?
Mhm.
And then they said you can do a tattoo and then make it look a certain way. I said, "Look, that's a lot of no, thank you."
Right,
I said,
right.
"I'll be fine." And for whatever it's worth, it's just the decision I made, and I'm not gonna change it. I don't wanna. They say I can always go back if I change my mind, if I want to do something, but I just didn't feel like it was important for me at that
Right.
moment, and I'm still feeling that way.
Yeah. I mean, it's just so many decisions that, you're confronted with in such a concentrated period of time. And these are major decisions. They're not and not only are they major decisions, but they're decisions that have to be made pretty quickly. I mean, you said that, your appointment was on Saturday, and then you saw the doctor Monday or Tuesday, and then you go to the
Yeah.
special. I mean, everything just kind of comes at you, so quickly.
Yeah, and so I had, triple negative breast cancer, and they said it was one of the most aggressive forms of breast cancer for Black women, and I'm like, "What?" So I think I had did this pamphlet one year, um, and so my topics were, um, what is cancer first, and then what is breast cancer? And the kinds of breast cancer. And then I had like the symptoms of breast cancer, what do lumps in my breast mean? So I had all that information that I wanted to, and then risk factors. So I was giving that information to spread out, but now I'm like, I'm going to have to probably upload it. I had created a Facebook page called Pink in the Hood,
Mm.
and I wanted to put that information out there. And because we just don't know. I don't think that's something regularly people think about. Cancer.
Yeah.
Why
Yeah.
why would I be thinking about cancer unless I'm having some type of symptoms? But a lot of times we have symptoms that go on with us that we don't necessarily correlate with um serious things. You
Yeah.
know, like, normally a person get a cough. They were like, "Oh, I drink some water, I clear my throat," or it's just small things that we don't correlate to serious things because the symptoms don't seem that serious.
Yeah.
But sometimes we can be going through some for a long period of time, and those are the symptoms, other things, and we just don't know it because um, we just don't. That's the whole important thing about having going to your doctor's appointments. And when they're asking you questions,
Hmm.
do your best. I am habitual for I will go to see my primary care doctor twice a year because I have them do my blood tests and making sure, that diabetes word is not coming up, high
Hmm.
cholesterol, high thing, because some things, they said some things are hereditary and
Right.
it be forms and what you may do and eat may not affect you, but it may do something to me differently.
Right.
Again, it goes back to those genes and what mama got, what daddy got, and the combination of it both. And it affect this child and not that child,
Hmm.
So it's we have to just be more consonant about the things that we're doing to our body, which is why the Honorable Elijah Muhammad said, "How to Eat to Live." And he had not one book, but two.
That's right.
And
Book one and
just
book two.
we have to, though that may not be something we know we don't eat pork. We know there are certain things that we don't eat, and that's a given. But when it gets down really to the detailed things, sometimes we may overlook them on our everyday journeys of eating and living life. We may forget some of those things.
Right. Now, Sister Vida, I just have a few final questions. If you have a few more minutes for me,
Sure.
I got to tell you, I'm really enjoying the conversation, and I just can't just say enough. I hope that listeners who are hearing this, it could be their first, it could be the first time that they're hearing about breast cancer, the inside of it. I mean, as someone who may know of a teacher who had breast cancer, or
Mm.
I remember they said my grandmother had breast cancer years ago, but it's not often that someone is really sharing their intimate journey and opening up. So I know that this is probably helpful to a lot of people. And then for those who have been through, their breast cancer journey and are survivors, um, it could be nice to hear a familiar voice, and and to appreciate you for getting the word out as you are. So I think this is probably one of my greatest conversations. I interviewed a sister that I met in New Orleans many years ago. I interviewed her about her son. His name was Kawisi, and he was a little boy who had brain cancer,
Mm.
and he passed away. And she has the Kawisi Prince Foundation in his honor. And I've never experienced terminal cancer, terminal brain cancer, or childhood cancer. I've not had that. So to hear her and to hear her talk about what that journey was like for her family, it was really illuminating.
Yeah.
So I'm grateful to her, and I'm certainly grateful to you. One question I have for you: I hear people say often, see it on television when they're doing interviews, if someone is dealing with a terminal diagnosis, or a cancer diagnosis, or a diagnosis of someone having like a debilitating um, illness or injury, and they call the person brave.
Mm.
They say, and she was just so brave. And I just never know if that's so, if a person feels brave, or you just think, well, I'm surviving. I'm living every day just like you. And if that takes bravery, they say, how she confronted or how he confronted his illness. So first, I want to know from you
Eh,
is what does that mean, or it
I'm
does it have
so
any
glad
meaning for you?
I'm so glad you said that because I think the person doesn't look at themselves like that.
Mhm.
I don't it's interesting, um, you see strong, bold,
Yes.
I think I've seen some of those words, along with breast cancer stuff, and I'm like, "Oh, okay, I guess that's when I am, alright,"
Mm.
and you may take on that persona like, "Oh, yes, dun, da, da, da,"
Yeah.
but sometimes I think we're just making it through,
Mm.
and well, I do tell you, I do know I said I have family members that I can guarantee that if it was them, we'd have never known. They would have
Mm.
kept it a secret. I can guarantee you that. And I'm like, "What is wrong with you? Like, how could you I see you. I'm around you." What is going on? You cannot possibly but I don't know. I don't know. I have to stop myself sometime. I, I'm at work and I put up my flyer in the locker rooms at work, and this young lady said to me last night, she said, "I'm so and so," because I saw somebody registered on my page. They said, "I want to walk. I'll get a t-shirt." I said, "Okay." But when I looked at her face, I was like, I don't know her by that name. Who is this person? But she's new to me because she's new at work. And she felt some kind of way about women sharing. She felt some kind of way about how a person decides, like when I told her about the self-care aspect of it. I don't think that that should be so. I said, "You know what, sis?" Because she said, "I was diagnosed," but then she stopped short and never said anything else. She never said anything else. You're what I want to say, you're what I'm talking about.
Right. This is
How
example right
you
here.
decide to take it on, you don't know why a person wants to share. She
That's
said
right.
my auntie or her grandmother had breast cancer, and she does something for breast cancer month every year. She wears pink every day for breast cancer month, and she makes these jackets. I say, you know what? That is good. Let me see your stuff. Let me see if it's something I would like to help you as you whatever it is you're doing, I wouldn't mind purchase. She said, maybe we can do something together, possibly.
Yeah.
I said, but never. I love my sister to death, and we always talk about never taking somebody's voice,
Mm.
never steal somebody's voice. If they wanted to share and feeling like that person shouldn't share, that if you're not the listening, you don't want to listen, then you need to walk away.
Yeah.
But to take somebody's voice, if they that's the brave part.
Mm.
Then want to share the intimate aspects of their life with you so that you're aware. Because sometimes we're silent so often that, we're that inner cry. And for some reason, the days leading up to my breast cancer walk, I've been feeling emotional.
Mhm.
I'm like, "When am I feeling emotional? This not your first time doing." I'm like, "I'm feeling emotional because for me, Nora, I'm telling you, I'm like, this is gonna get big.
Yeah.
Y'all gonna hear my name. Not so much of I'm special, but this sister wants to make sure you're aware."
That's right.
I had a lady said, "I went through breast cancer." Okay. And walked away. And she's very good friends with my cousin.
Mhm.
She's a smart, intelligent, well-educated woman running her own firm with some people. What?
Yeah. And I appreciate what you said about trying to shut or diminish someone's voice. And what came to mind when you said that is that that person finding purpose, even if it's in like the jackets or, or the wearing pink every day, that could be part of the person's healing. That could be part of the person's grounding, they're
Yeah.
strengthening. We don't know. We wouldn't know what somebody is going through, like you said, in those late hours when we're all sleeping or those early mornings. And these conversations that people have, the foundations that they create, the walks that they have, like
Yeah.
that certainly can help people find purpose, um, and contribute to the person's healing. So I'm really glad that you did say that.
And I had somebody, why don't you join somebody else? Or why don't you donate? Like, where's this money going to? I say, whoa, hold
Wow.
on.
Wow. We don't ask Susan G. Komen, do we?
No, we do not. And we don't know if all the money going. I say they've been doing this for years.
Yeah. Yeah.
And here's what I say. We have to fix the other, help people. And finding the cure, doctors are going to always do, the doctors, scientists, they're going to always do that, find the cure. But
Mhm.
raise all the money that is raised.
Yeah. And what you're
And
doing.
I tell you, Susan G. Komen, when you're joining them, like, let's say I want to walk. That's my purpose. I want to walk along with you. I have to raise money in order to walk.
Right.
I have to raise money. And we're talking about raising some money. So
You.
now way before my cancer journey, I wanted to do that.
Mhm.
And I'm like, I don't have that kind of money. Now I got to how do you ask somebody to support me in raising some money so I can do this walk? Why are you doing the walk, Evita? At that time, like, why are you doing the walk?
Mhm.
I didn't have a purpose for doing the walk other than this is what I'm supporting, and I'm hoping that you're going to do something right with the money.
Right.
So, but now people questioning my part, and I am a person, and I told people, if 10 people show up, if I'm the only person, I'll do this walk alone.
Mm.
You trust and believe that I am a person. I'm going to do it if I have to do it by myself. I That's just my belief in it. And
And your walk is going to support women. Like I
yeah,
think earlier you talked about, for example, a salon visit. Some of the
yeah,
some of the things that are, I guess we could say, low hanging fruit that maybe some of the other foundations, aren't thinking about. If they're thinking about medical research, if they're thinking about medical technology, what about the woman that just wants to go to the salon, or wants a new outfit to feel good,
yeah. And because I just remember, I remember. And then some people want to wear wigs, and I do know the American Cancer Society or whatever, that you can call them and you go through some places, get wigs. Let me tell you something. Not everybody know how to do Black people,
Right.
but I know a lot of sisters who do wigs.
Yeah.
And my niece, she does. So if
Mhm.
I could get her, like, look, I had a sister who wants a wig. She wants to wear a wig. She doesn't want to be bald headed. Can you make a wig? Can you come here
Yeah.
and do something for her? I'll pay you. That's the whole purpose of raising the money,
Right.
because people think that that's nothing. But do you know the industry we live in today with nails, hair, and teeth? And I'm just talking about, they just want something normal.
Right.
They just want something normal. They're not trying to do to lose. For a lot of women, losing their hair. If you go on YouTube and something, breast cancer, and the videos of women or their families all cutting their hair off too when they lost their hair so that they can feel normal
So they can feel normal. And that's what
and
Pink
not alone.
and that's what Pink in the Hood is doing, is helping women achieve a sense of normalcy even
Yeah.
while they're going through the journey. And you said something earlier, that I did want to return to, when we are in the midst of somebody who's going through this journey, who's just entering the journey. You said, "I'm sorry this has happened. Is there anything you need?" Knowing the right thing to say, and And, I think for everyone, it may be a little bit different. And I think sometimes it helps to say, I don't know what to say, or how can I help you?
Yes.
Because and you said this earlier about the patient. The patient also has to understand the people don't understand. And it happens with grief. I tell people, when
Yeah.
they're dealing with grief, look, I know you're thinking about your loss all the time. And people are saying, well, aren't you over it by now? No, it still feels
You
fresh. So
never will. And I
so
don't think that's something people you'll never get past that. You'll never
yeah.
get past that. I was watching, I don't know if it was Netflix or one or the other, so many years after with Katrina, Hurricane Katrina, and this family, and this guy said, "We were the children. Nobody never asked us
Mhm.
how we were feeling.
Right.
Nobody said any." Every one of his cousins, they were all young. They were children.
Yeah.
He said, "Nobody asked us how
Right.
we feel." They just went about, and whatever changes that came that they had to make, they made. Nobody, when people die, nobody says anything to the children.
Right.
Ask it. No, how does so if you didn't get past it, why are the children supposed to get past it?
Right.
No, it doesn't work that way. And it's always with you.
Right. And so I think, being or knowing, and maybe people will know from this conversation, knowing it's okay to say, I don't know what to say, but I want to help.
Yes.
I don't know what to say, but I'm here. I don't know
Yeah.
what to say. Please tell me what to say. We can and we should, be learning a lot from this
And
conversation. We
that shows vulnerability on their part too. It's like,
yeah,
oh, they're trying. Somebody has
exactly.
that, like, okay, they're trying, they're concerned, they're
Yeah.
showing concern.
Yeah.
And that's something too, because I mean, you don't know. I mean, on both ends, you don't know what to do or say because it's new to them. It's new to them. I'm like,
Yeah.
you got nervousness.
Yeah.
Sometimes I said I have to stop using the word depression because there's different forms of depression, or a moment of feeling low, or a moment of feeling sadness, a moment of just loneliness, and that goes with it too. And you can be surrounded by so many people and feel the same, feel this thing.
Sure. Right.
And knowing how you're gonna now, like for me, sometimes it's music. I'll have to, listen to my music, or I may want to get in my car and go for a drive, or, eat some French fries,
Mhm.
So I mean, it's, whatever it is, you need to find what it may not always be great, but it's not is you don't want people to turn to the negative. It's not
Right.
the alcohol, it's not the drugs, it's not, self whatever mutilation to yourself. You
Mhm.
want somebody to find something, but we have to see it. And then
Yeah.
that's another reason we don't seek help.
Right.
We don't
Right.
seek help.
Right.
And
Sister Vida, one of the things I say with this podcast is be the movement. And you are definitely demonstrating that through the work that you're doing, not just with Crow, which is a wonderful organization, and
yes.
listeners to this podcast who've listened over the years are familiar with Crow. However, even through you having been transparent through your journey before Pink in the Hood and what you shared with all of us who follow you on social media. And now you have this great movement, Pink in the Hood, with your annual walk. So, as we are concluding, Sister Vida, talk to us. Let us know where we can follow you on social media and how we can support Pink in the Hood.
I have a Facebook page. It's called Pink in the Hood. It's PINKINDAHOOD. And you can go there. If people want to make donation, because I accept $5 too. A dollar, five. And then you can do pink in the hood at gmail.com.
Okay.
Um, I reserve my phone number. Well, you
Yeah,
know what?
no,
It's like
no,
nobody
no.
really
You don't need to give your phone number. What I'll
okay,
do is I'll make sure that I include links to the Facebook page, Pink
okay,
in the Hood. We're not going to give out your personal information. All right. Well, I'm joining the group right now on
okay,
Facebook, Pink in the Hood, and we're able to donate. The information to donate is there
okay.
on the Facebook page, and I will make sure that I include that information.
Cash App is the dollar sign buttons, BUTTONS 3, and so that's my Cash App, and then well, my email for my Zelle is Evita Ali 3 at gmail.com.
What I'll do is make sure that I include your Zelle and your Cash App in the show notes so that
Okay,
listeners can have various ways to reach out to you and support you. And
okay,
I don't just encourage listeners to support and follow our sister Evita Ali at Pink in the Hood on Facebook. But definitely we want you to do that to follow and support the third annual Pink in the Hood Walk for Breast Cancer. We also want our listeners to support you at Crow. So
yeah,
you can go to Crow TV on Facebook and you can support that great organization that's bringing us great independent Black media, media that's helping us to think, media that's giving us information, and media that is helping us to make a difference in our own communities. So I'm very grateful, sister, for having you on the show and sharing what you had to share with us and your transparency, the vulnerability, um, and the caring that you give. I don't mean to be silly when I say sharing is caring, but it's true.
it is, it is.
And we've gotten so much from you, and so thank you so much for joining us.
I thank you for having me.
Thank you for listening to another episode of the Nora Speaks podcast. Be on the lookout for a new episode coming at you fresh next week. And as always, if you want to learn more about me and the work that I do, visit my website, norahmuhammad.com. Or if you have a listener question, email me at info@norahspeaks.com. You can also follow the Nora Speaks podcast on Facebook, Instagram, and Twitter at Nora Speaks Podcast. I'll be sure to include links in the show notes. If this show has value to you, please subscribe, rate, and review, and share it with family and friends. And be sure to check out previous episodes. And remember, don't just join the movement, be the movement. Stay in peace.